right? Red blood cell transfusion. That's when we're going to see most of these transfusion reactions. But patient can also have transfusion reactions, especially the non-hemolytic type, if they are getting maybe blood for other reasons, plasma, fresh packed platelet, or fresh frozen plasma for coagulation factors, etc. Yeah. So for transfusion reaction, the two major categories, right, is going to be, to make life easier, it's going to be either hemolytic or non-hemolytic transfusion reaction. So a patient starts getting they are transfused with some blood products, and you can have some sort of reactions shortly before, shortly after starting the transfusion, or sometimes within few days after getting the transfusion. So most likely it's going to be transfusion reaction. What you want to do immediately is to determine if it's hemolytic transfusion reaction that the patient is going through, undergoing, or is a non-hemolytic transfusion reaction. And hemolytic transfusion, if a patient gets red blood cells and there are antibodies against the antigen and the red blood cells in their blood already, patient has acquired antibodies. We're going to see this in patient that has had recurrent transfusion in the past, right? So the more transfusion I have already, the more likely I'm going to start creating antibodies against antigens on red blood cells. So if you transfuse a patient with incompatible blood, especially for the ABO antigens, right? So like a patient with blood type A, or blood group A rather, getting B, blood group B, red blood cells, those patients are prone to, they're going to have antibodies against B, and they can start developing, right, destruction of those red blood cells within the blood vessels. So as we said yesterday, transfusion reaction would be an example of intravascular hemolysis, right? So you're looking for those evidence of intravascular hemolysis in a patient that has undergone recent transfusion, especially with red blood cells, and we're going to be thinking hemolytic transfusion reaction. So you're looking for the hemoglobin, there will be increased free hemoglobin in their blood, right? Because they're going to be giving all those labs, there will be hemoglobin anemia, haptoglobin level will be low. Hemoglobin will be filtered by the kidneys, right, into the urine. So their urine too will turn red, yeah, or pinkish in color, and there will be elevated hemoglobin also in the urine. So they're going to have hemoglobin urea also, and there will be increased LDH, because LDH is normally within red blood cells. So if there's increase in hemolysis, LDH will be released into the blood, right? So once you see this evidence of hemolysis, intravascular hemolysis in a patient undergoing transfusion, we are thinking hemolytic transfusion reaction. If it's within 1 hour, so time, because there are two types of hemolytic transfusion reaction. There is immediate or acute, and there's delayed. So if this occurs within 1 hour, you see this evidence of intravascular hemolysis within 1 hour of starting transfusion or getting a blood transfusion. We're thinking acute hemolytic transfusion reaction, AHTR. If it's delayed, so this occurred after about 2 to 10 days after getting the transfusion. So that's going to be delayed hemolytic transfusion reaction. In acute, which is more severe, it's very, very severe, right? It's a serious problem, because this can lead to end organ damage, like kidney injury, can lead to DIC and shock. So in acute, they have antibodies. It's due to ABO incompatibility. A patient with blood type group A getting blood group B, right? A patient with whole antigen getting AB blood group, or A or B blood group, right? So that's going to be in ABO incompatibility. The antibodies will start destroying the red blood cells, so they will be massive, right? So we're going to see evidence of intravascular hemolysis. They're going to be anemic, right? In this case, we have to stop the transfusion immediately, right? We're going to stop the transfusion immediately. That's your treatment. Like, stop transfusion immediately. You order the labs once you suspect hemolytic anemia, right? Hemolytic transfusion reaction. So complications that can occur, or other findings you might see in this patient: hemoglobin can damage the kidneys, right? Hemoglobin is nephrotoxic. It's going to cause AKI, right? Acute kidney injury, acute tubular necrosis. So this patient, we have evidence of AKI. The urine is going to be brown because of muddy brown cast. Microscopy too will show muddy brown cast. They're going to have flank pain also. Flank pain. If you palpate over the kidney, it's going to be very, very tender. Patient will have fever. It's going to be accompanied by fever, chills, plus evidence because of inflammation and stuff. Also, DIC DIC can develop here. If the hemoglobin damages the endothelial cells, they can develop DIC. They can even go into shock in severe cases, right, because of DIC and co. So we see evidence of intravascular hemolysis, acutely severe evidence of severe organ damage, AKI, within 1 hour of starting transfusion. Acute hemolytic transfusion reaction, stop the transfusion immediately, right? That's how we treat this. If it's delayed, this occurs within 2 to 10 days. They got the transfusion 3 days ago, 4 days ago, 5 days ago, and now they're presenting with evidence of intravascular hemolysis. Except in this case now, this is going to be a milder form. There's evidence of intravascular hemolysis, but they won't present with severe anemia. There will be no flank pain here. There will be no brown urine. There will be no AKI. There will be no fever, chills, no DIC or shock, right? So this is going to be delayed. The antibodies are still made against antigens on red blood cell, but the antibodies are made against rare antigens. So the hemolysis here is slow. It's slow onset, it's slowly progressive, unlike ABO antigen, which are much more common and will lead to severe hemolysis. So in this case, we don't need to stop the transfusion here. You can slow down the transfusion. If they are still getting transfused, right, we're going to slow down the transfusion in those patients. This one is not associated with what complications, right? So it is a milder form of acute hemolytic transfusion. So this acute one is the one you should pay attention to most likely tested, and the reason is because of the complications. We have to know to stop the transfusion immediately, even before you order any test if you suspect acute. So now our patient